Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about anti-aging interventions for the treatment of cardiovascular disease. The problem, aging and cardiovascular disease. Aging is the leading risk factor for developing cardiovascular diseases, which are the primary cause of morbidity and mortality worldwide. The cardiovascular system operates under constant stress and has limited capacity for cellular replacement. Currently, there are no approved cardiovascular therapies that directly target the aging process itself. Epigenetic rejuvenation. Epigenetic alterations, changes in gene expression without DNA mutation, are a hallmark of aging. These changes involve factors like histone modifications and non-coding RNAs. Therapeutic targets include histone-modifying enzymes, for example, HDAC inhibitors, which have shown promise in improving diastolic dysfunction in animal models. DNA methylation inhibitors, which reduce plaque formation in mouse models of atherosclerosis. Aging is characterized by a dysregulation of nutrient-sensing pathways. Caloric restriction, a well-studied metabolic strategy, has shown significant geroprotective effects. It improves cardiovascular health by reducing age-related cardiac remodeling, improving diastolic function, and reducing vascular stiffness. Caloric restriction achieves this by influencing key pathways like mTOR signaling and sirtuin activity. mTOR, mechanistic target of rapamycin, is a master regulator of cell growth and metabolism that senses a cell's environment. When conditions are favorable, with plenty of nutrients and energy, it promotes the building of new proteins and fats, while inhibiting the recycling process of autophagy. Sirtuins are a family of proteins that regulate cellular health and metabolism by using NAD to perform various functions. They play a crucial role in responding to cellular stress and energy levels, influencing processes like DNA repair and gene expression to promote longevity and protect against age-related diseases. Mitochondria, the cellular powerhouses, are key metabolic targets. Improving redox balance with mitochondria-targeted antioxidants, for instance, MitoQ and elamipretide, has shown vasoprotective effects and improved cardiac health in animal models. Nicotinamide adenine dinucleotide, NAD, a vital coenzyme, declines with age. Replenishing NAD using precursors, for example, nicotinamide riboside, improves vasoelasticity, reduces blood pressure, and lowers inflammation. Autophagy activation. Autophagy, meaning self-eating, is the cellular process of recycling damaged components. Its efficiency declines with age. Dysfunctional autophagy is linked to numerous cardiovascular diseases. Therapeutic strategies focus on stimulating autophagy. Inhibiting the autophagy suppressing target, mTOR1, with drugs like rapamycin can improve cardiac function and extend lifespan. Activating autophagy with natural substances like spermidine has shown cardioprotective effects and improved lifespan in mice. Suppressed inflammation. Aging is associated with a state of low-grade inflammation called inflammaging. Targeting inflammatory pathways has shown clinical benefits in cardiovascular disease. Two main areas are being studied to reduce this inflammation. Targeting the NLRP3 inflammasome. This is a part of the immune system that can cause inflammation. Drugs like colchicine and canakinumab work to calm this pathway and have been shown to lower the risk of future heart problems in patients who have already had a cardiovascular event. Clonal hemopoiesis of intermediate potential. This refers to the presence of mutated blood cells that can drive inflammation and increase the risk of cardiovascular disease. Anti-inflammatory treatments have been successful in animal studies for treating inflammation caused by these mutations. Senolytic therapy. Cellular senescence is a stress response where cells stop dividing but remain metabolically active, releasing pro-inflammatory factors. Senescent cells accumulate with age and contribute to cardiovascular diseases. Senolytic agents selectively eliminate these cells. Therapeutic examples. A combination of dasatinib and quercetin have been shown to improve vasomotor function and reduce vascular calcification in aged mice. The drug navitoclax has improved vascular function and plaque stability in atherosclerotic mice. Fisetin, a natural flavonoid, also improves arterial health. Interconnected mechanisms. The anti-aging strategies are not isolated. They often overlap and influence each other. For example, targeting inflammation through NLRP3 can also induce autophagy and metabolic reprogramming. This suggests a holistic approach may be most effective. Challenges. The translation of these findings from animal models to humans is difficult due to the lack of clear, objective endpoints for measuring biological aging. Conclusion and future perspectives. Aging should be considered a modifiable risk factor for cardiovascular disease. Emerging strategies hold significant promise for primary prevention by targeting subclinical changes in the heart and vessels that precede symptomatic disease. More research is needed, particularly in diverse populations and with sufficient female representation to understand sex-dependent differences. Future studies must focus on translating preclinical success into safe and effective clinical treatments for humans. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.